Welcome back to Transform Your Mind to Transform Your Life, the podcast. You're listening to Author's Corner, where we highlight and showcase our local authors. Today, I'm speaking to Dr. Josh McConkey, author of Be the Weight Behind Despair. And Dr. McConkey and I are going to be talking on the topic, how does natural disasters like hurricanes affect our mental health? Welcome, Dr. McConkey.
Thank you for having me on the show. Very important topic, so thank you.
Yes, you're very welcome. Yes, I'm glad we're able to discuss this. So let me give you guys a brief introduction. Be the Weight Behind Despair is a call to action for Americans to utilize our best resource, our people, coaches, teachers, volunteers, and family to save the Gen Z COVID generation before it's too late. Josh says, as an emergency doctor, I see the anxiety, depression, and suicide. And as a commander, I see the lack of leadership skills and resiliency. As the founder of Be the Weight Behind Despair Foundation, Josh is actively working to raise funds and awareness through North Carolina to help those in need. His mission is to provide resources, mental health support, and leadership-driven solutions for individuals and communities struggling to recover. Drawing from real world experience in crisis response and his work in mental health advocacy, Josh offers actionable insights on how we can rebuild, not just physically, but emotionally and mentally. Awesome. Now, Josh, we're going to be talking or focusing in today on the mental health challenges facing Western North Carolina in the wake of Hurricane Helene. So, are you a resident of Western North Carolina right now,
No,
or
I live in Wake County, just
okay,
between just right on the edge of Chatham County. I'm about three hours or so to the east.
okay. So were you affected by the Hurricane Helene?
We had extreme winds and a lot of rain, but nothing to the near the amount of rain that was sustained in Western North Carolina. It was just biblical level destruction with winds, rains, the flooding.
Yeah.
Just very powerful. I think a lot of people, most people have seen the images, the videos that have come from that.
Yes.
Really, really hard to watch that. It's one of our favorite family destination spots where we've done a lot of vacations, Asheville, Boone, and
Yeah.
those regions, and seeing that destruction, that's been very hard.
Yeah, and it came from Florida. I'm in Florida.
Hmm.
That was the path, but you guys
Yeah,
got it a little worse than we
my
did.
wife is from Fort Lauderdale. She has lived through many hurricanes,
Yes.
and this was a very big storm.
Yeah. I think one of the first ones that hit North Carolina and this, right, from what I remember from it, the reason that North Carolina got plummeted is because of the mountain ranges. Something about that?
Yeah, just the airflow, the pressure changes, and it just followed
Yeah.
along that track, and then it just hits the
Right.
mountains, and boom, just
Yeah, I am
crazy winds
understanding.
and water. Mm.
Okay. So what are the biggest mental health challenges facing Western North Carolina in the wake of the hurricane?
So right now, what you're seeing is just simple access to care that's really been affected for many different reasons. And when you look at the American healthcare system, when you look at mental health, we're not very well resourced on our very best day. So there are big limits on mental health resources across the country. North Carolina is not unique in that respect, but there's no room for error. There was no room for that to flex. So when you throw biblical level flooding and rain and wind, so it was logistics issues, even physically getting to areas where you could get care. There were roads completely washed away. Getting your medications, let alone just getting the access to care, getting to see your mental health provider, getting to the hospital, getting to those medical facilities was impossible. So those that access to care was
Yeah.
sadly
Yeah.
affected.
I'm getting the visual now of yeah, I mean there was a kid that was washed away and
Mm,
with his mother. There were people because they had no access to even Wi-Fi signals, and there were people that were there for a week without no communication outside.
hmm
So I mean,
Elon
well,
Musk had to come in with satellite,
right.
to drop those in to get satellite coverage to get internet. Just simple
Yeah,
communications that affects logistics and
was
access.
really
And
bad. But we're talking about first of all the stress of your house washing away, or just the physical stress and the physical problems that come after an emergency zone. But now what we're talking about is the anxiety that comes from that. In addition to if you had anxiety before, or if you had mental health issues before, is that where we're going with the conversation? And this was a compounding effect?
everybody has a breaking point. So I've worked in special operations. I've worked with some of mental, the mentally toughest human beings on planet Earth, just physically and mentally. There are still suicides in those populations. And it doesn't matter how hard you are, how tough you are, how strong you feel that you are. Everybody has a breaking point. And when you have that type of just biblical level destruction, whether you had mental health issues prior to that or not, when you put yourself under those types of stressors, when I was in Iraq in 2007, it was a crazy emotional roller coaster for me. I'd never been in a combat zone before. I'd never been shot at. I never had mortar fire. I was flying medevac and did one air assault. Craziest and scariest thing I've ever done in my life. And with that, my faith really helped bring me through that. And, all of those, when you have these types of natural disasters with that much destruction, it's every bit as traumatic, even worse, than, being in a combat zone. There's the
Mhm.
death, the destruction. I mean, your home, your areas of work, you can't get from place to place, just logistics, communications, access to care. Everything is completely destroyed. And that's incredibly stressful. That's about as stressful as it gets.
Right. Well, it's really great that we highlight that because, you know, for instance, we just had the fires that, from
Oh,
LA,
California
and
fires were devastating.
nobody was talking about the mental health issue. Everybody was talking about sending money to rebuild and give them back their home. But no, and like I said, I live in Florida, um, and been through a lot of hurricanes. I have never had my house washed away, even though I'm close to Fort Myers Beach. You know what happened to Fort Myers Beach?
I
That
do.
was the
My
first before North Carolina, where you saw houses, or not even houses and buildings just floating away. When you go there now, there is nothing there. It was amazing. So yeah, you've got to condition yourself with the fact you've lost everything, and then you've got to, but yeah, it's very, nobody thinks about the anxiety or the mental health. I mean, I walk in the park every day, and I'm close to Fort Myers Beach. And there's one time I'm even thinking it was Helene, that when we were expecting it, I was walking, and there is this lady that was walking with me, and she was saying, "Oh, we lost everything in Ian, and now I have all this anxiety about this one that's
mhm.
coming," because that's what happens.
Yeah,
If
the
you were not
anxiety, the
anxious
depression.
before,
Oh, goodness.
right?
How could
Yeah,
you not have those feelings going through
yeah.
that?
Yes, and you're right. I'm not sure if we are addressing those. So I'm kind of glad that we are kind of highlighting that. I mean, for instance, when there's a shooting in a school, they know that the kids needs help to get over
Mhm.
it. But is there anything in North Carolina or anywhere else after disasters where the healthcare system is opening the doors for support?
When able, there are some federal and some more state resources that come in during these types of events and do address that significantly. It's not enough. I mean, it never is enough. That level of destruction was just not anticipated. There are resources. The best thing you can do is highlight the problem. Because if you
Right,
don't know it's a problem, you can't fix it.
right.
So, talking with your state legislators, your congressman, your U.S. senator, like we need those resources. President Trump flew there personally in Air Force One with a congressional delegation to let them know that they hear them, that they recognize the issue, and that they're going to address that. So, recognizing the problem is number one. And
Hmm.
then there's all many ways to attack that problem, but getting those resources there right now is people are still without housing, still
Yeah.
struggling to find food, shelter. I mean, it's been cold. It's the mountains this time of year are freezing. It's
Wow.
absolutely brutal.
Yeah, yeah, yeah. I haven't seen anything on the news about it because you're right. They're going from one crisis to the next. They can't, they don't, that's like old news now.
Yeah,
But
it's a crazy world. Then you see all the plane crashes,
yeah,
the
I know,
midair
right?
collision in DC and Philadelphia, and now a plane overturned and crashed.
In
And
Toronto,
you
right,
saw the videos in
right.
Toronto today. It's the world
Yeah.
is a crazy place. And every time you see these types of events, if you've lived through something like that, it's like PTSD. It brings that anxiety, those levels right back.
Yeah.
So, for people that have experienced those things or have family members that have experienced those, every time you see something on the news, it's incredibly anxiety provoking. So there's a lot of
Yeah.
mental health repercussions when these events happen.
Wow. Yeah.
And as an
Oh,
emergency doctor, that's where they're coming in to see me, right? So,
right,
I've seen so
right.
much anxiety and depression, and unfortunately, when you don't recognize those signs or those symptoms, and you don't have the resources, and you don't have a strong family, that weight behind your spear, behind you, I
Hmm.
see the suicides, and I sit down with those families, I cry with them. I've done that hundreds of times over 20 some years now, and it breaks my heart every single time. So that's why I push so hard to recognize those mental health issues. Everybody has a breaking point. Nobody is just too strong to ever have to go through something like that. Like life will break you eventually. Recognize it. Go seek help. You can always go to your emergency department. If you can't get in to see your mental health provider, or you don't have somebody to talk to, come on in and see me. Like we are the safety net for the nation. I'm proud of that.
Okay.
We don't have a lot of mental health resources either, but we're there for you.
Okay. So that's pretty good. So, when they're feeling anxious with like the PTSD, when there's another storm coming, or rain's falling, or so basically, how do they get services? You mentioned going into the emergency room, but nobody likes to go to the emergency room. Is there like a hotline that,
Well,
that
now there's
that's
flu and
there?
COVID around everywhere. So yeah, there's definitely hotlines set up around communities. The federal government has a hotline. Each of the state the emergency operations centers generally will have some phone numbers for people that are struggling, and then your local healthcare, county hospitals, local hospitals, and those medical facilities. Your emergency department is the one that I always point out. But
Mhm.
the best thing is to have that strength and that weight behind your spear before all of this goes down. So
Okay.
getting out in your community, getting involved, family, friends, coworkers, like build that network around you. Be that network for someone else, be a part of something or someone that matters, getting involved in your community, engaging in your community, just little things, coaching, teaching, being a mentor, volunteering in your church, your school, that builds relationships, that builds bonds. So when these types of things happen, you have people that you can lean on, and then they can lean on you. And that's what builds healthy communities. And that's the best resource we have in this country. It's our people, you know, utilize
Yeah.
that resource.
Yeah, the churches are a very important part of the community, and the churches are always there to, like I said, the churches and FEMA and the government agencies are there to look after the physical parts, food, clothing, maybe someplace to live. But I was not aware that there is either any mental health programs available because I didn't think about it until we're having this kind of conversation.
Yeah,
But
people don't
yeah, I
think about
mean,
it until they're put in that situation.
right,
And
exactly.
so, the best thing you can do is just have that team of people and friends and family and your church, your faith around you before things like that happen. Right?
Yeah,
It's
well,
you kind of hard to build those bonds with no communication and the
right.
roads are washed out.
Yeah.
Just do what you can now to get involved in your community and build those relationships.
Well, that's actually pretty good. So the work that you're doing and the book that you've written, it's a great title, The Weight Behind the Spear. So explain what you mean by that. What is the weight and what's the spear? And I know you have
Yeah.
a foundation.
So, the weight behind the spear. When you describe that, I talk about the tip of the spear. So everybody knows our heroes out there, police, firefighters, special operators, firemen running into burning buildings to go save lives. That's the tip of the spear. You know, I'm I've worked with special operations. I've been very fortunate in my military career. These men and women do absolutely crazy, amazing things that I know I cannot do. I don't do those things, but I save lives and I can be the weight behind their spear. Every single one of these special forces operators, your firemen, your police, all these people had somebody in their life, a favorite coach, their favorite teacher, family, a mentor in their life that gave them the confidence to do what they do.
Mhm.
Be the weight behind the spear for somebody or something that matters. And this book was written to empower people. I need them to realize how important their role is, that what they do every single day does matter. Life is a team sport. Like we need everybody, all hands on deck. And so this book is that call to action to get people out there and get engaged, build up this next generation of leaders. These are our future heroes.
Okay, awesome. But you mentioned the Gen Z COVID generation. So, what is special about them?
So this is a generation that has not ever lived without an iPhone. So the iPhone, the iPad generation, they've already had some very unique challenges growing up where they struggle with communications, they struggle with some resiliency, for a lot of different reasons. But then you threw COVID in there and you shut them out of church, you shut them out of school.
Oh,
They
yeah.
already had issues communicating with one another without their iPad or iPhone in front of them. And so those are just critical years of development. There were 2 or 3 years where you just shut them out and it was not good for them. So the mental health issues, the anxiety, the depression, the suicides that I see as an emergency physician now, and as a military commander, I'm a commander in the Air Force Reserves, and this same generation they lack a lot of resiliency. They fold just at the smallest different obstacles. They have trouble overcoming obstacles. And then
Mhm.
just some of the basic leadership skills and communication and just things that they need to have to be successful. And it's not the older generation, oh, well, back in my day, these kids are just lazy. Like, no, that's not helpful. Like we have to own that problem as a country, as community leaders, as business leaders. What are we going to do about it? Because whether the perception is fair or not for them, that perception is their reality. That's their world, the digital world, the social media, all of this. And for that COVID generation, for Gen Z, it was not good, and we have to do something. So this is my prescription to fix that problem, and it's been well received so far.
Yeah, it is very true that the younger people, I mean, I didn't categorize them as
Yeah,
Gen Z or the COVID generation, but yeah, the early 20s is where that you find the young people are struggling. It's a lot of suicides. There's a lot of social
sadly.
media, right? Social media bullying and you're right. They're not able to cope. Why do you think that is?
There's,
You're thinking it's
every
because they're stuck in their cell phone? Is that why they're not
Well,
learning
every
skills?
generation has their own unique challenges, right? You
Mm,
have the depression generation. You've got what
right.
I call the greatest generation, your World War II generation. Boy, I mean, like the fate of the world was resting on their shoulders.
Mm,
For this generation, social media, had come onto the scene, and you used to have to walk up to a kid and punch him in the nose, and now you can just badger them incessantly on social media and make their life hell. There's
yeah.
there's some positive things to social media, having that interaction, group chats, and it's just a different form of communication than what I grew up with. But for them, that is a positive thing. But then on the negative side of that, there's like the body image issues, and they're just what they're seeing is it's not reality. I mean,
Right.
it's like a TV show. Everyone always posts their best things. They never post their bad moments, right?
Right.
And so they've got these artificial like conception of what life is really about. And
Hmm.
it's really not healthy for development, certainly under age 16. There's been some
Hmm.
great studies and some policy papers by the American Academy of Pediatrics that really, even almost under 18, limiting some exposure to social media. But,
Hmm.
they're just unique challenges that we have to find a way to overcome that. You can't just, blame and make fun of them. And it's not that's not productive. Like we have to own the issue, and so we have to find a way to get through to them and help them be successful. So they're just, it's a different challenge than I grew up with, but we have to embrace that. We got to find a way through,
Oh yeah, for sure.
adapt and overcome.
Wow. We're bringing up some important issues in this short conversation, right? So, yeah, I mean, both of those things, where we're talking about the Gen Z problem with social media and self-esteem and you're right, body image and all these different things being bullying, being cruel. That's one aspect. And then we're having all these disasters everywhere now. So a lot of people are having fear and anxiety and mental health issues and wow, wow.
Everybody's
That's
got that breaking point, and for just
yes,
some people, it's a lot lower threshold than others, but it's that's still an issue that has to be addressed.
right, right. So tell us about your book. Are you addressing some of these issues in your book? Why did you write the book and what do you want people to walk away with after reading?
So, I wrote the book to address these exact issues. So I felt like I was going to work every day and just kind of smashing my head against the wall, seeing the same thing over and over. And you see the, it's just it's reaching a critical point. It's clearly an epidemic, the mental health crisis, and then you throw that with the opioid crisis and a lot of overdose deaths that I deal with. Boy, the fentanyl crisis alone, we were killing 100, we still are, 120,000 people a year and
Wow.
more. It's just getting worse every day. It's the number one leading cause of death for 18 to 45 year olds. It's just
Wow.
fentanyl.
So you think
So
they're trying to medicate to
yeah,
feel better?
there's an element of that for sure.
Okay.
With drugs and alcohol, that some people, those ineffective coping mechanisms, those are things that people will lean on, and unfortunately, that's where you see a lot of those overdoses. So that, and then as a military commander, that same generation just struggling in the military, and as a commander, well, we have to find a way. Like if we don't have a successful military, we're in a big problem. So that
Right.
really motivated me to write the book. It's getting that message out to as many people as possible. It's won several awards, Independent Press Award, Nonfiction Writers Association, nonfiction authors, and it was actually it's been accepted as a formal submission for the Pulitzer, which is very cool.
That's
I guess
beautiful.
we find out in May. I would be very shocked to win that one as a first time author, but I think it's just a
Well,
message that
nomination is
resonates.
just as good.
Yeah, yeah, thank you. So it's a message that people can understand, they can wrap their heads around because they see it around them every single day. So
Mhm.
this is a prescription to fix that problem. And it's a team sport. We got to do this together.
Wow, great. So, do you offer suggestions for mental health in the book? You're teaching them to be the weight. Is that
Yeah,
the focus
absolutely.
of it?
Just things that we talked about earlier, having that support structure around you before everything collapses. People, friends, family, coaches, getting involved in your community, the more organizations that you're part of. There's hundreds, there's thousands of organizations in your own community that you can reach out to. Maybe you don't particularly like people and you don't want to coach Little League T-ball. That's okay. Go
Mhm.
to your animal shelter. Volunteer with
Mhm.
these animals that then become some emotional support animals for somebody. Or
Right.
volunteer in your church, your school. There's so many different organizations,
Mhm.
like local shelters. I mean, there's so many things that you can do to just get involved and then find like-minded people and have that weight behind your spear that propels you forward to do great things. Just being part of something or
Beautiful.
someone that matters, because what you do every single day does matter.
That's beautiful. Now I can understand why it's been so well received. But yeah, so
Thank you.
we have to we're not just here on this earth for ourselves, right? We're here to help other people. And whenever you're helping other people, that's when you're on purpose. So it's actually good to have something that highlights the problem and give some solutions for it. So that's good. And it's a unique title too.
Yeah, thank you. It's my personal leadership ethos. I've used that as my command ethos. I've got it in a Latin inscription on my challenge coin, gravitate hastum, gravity of the spear, weight behind the spear. Um,
Good.
yeah, it's kind of my personal leadership ethos.
Okay. That's beautiful. And now you're sharing it to the world. That's awesome.
Got to get it
All
out there. So thank you.
right. You're very welcome. Now I saw somewhere where you're a lottery winner and you're
So with
putting some of
that,
your own money behind this.
yeah, been very fortunate, very blessed. We won
Mhm.
the North Carolina Educational Lottery February of last year. And so
Okay.
we've used the proceeds for that. We started the Weight Behind the Spear Foundation, that's getting people, we're promoting community engagement, promoting volunteerism, getting that message out into communities, letting people know how important they are. We've been raising money for Western North Carolina to help with the emergency efforts and the rebuilding, because that's a decades long
Yeah.
rebuild. That's not going to happen
Yeah.
overnight,
Right.
several years. It's going to be decades. And there's some areas that just cannot be replaced or rebuilt.
Place.
There's been that much damage.
Oh,
So,
wow.
I feel very fortunate to be in this position. I have a very strong faith. It's all happened for a reason, and we're
Reason?
trying to do
Yeah.
something positive with that.
Oh, that's so beautiful. That's awesome. 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 It's a feel good interview. So that's amazing. All right. So tell so tell our listeners where they can connect with you, get involved in your foundation, your website, where they can pick up a copy of your book. And if you're on social media, what is your handles?
Thank you. So weightbehindthespear.com, WEIGHT is their website. The foundation is weightbehindthespear.com/foundation. You can follow me on Instagram. It's Josh McConkey MD. On X, it's McConkey 007. The book is available at Amazon, Barnes and Noble. There's the paperback. We have an ebook, and the audiobook is out as well. That came out September 11th of last year. So,
Mhm.
there's you can read, you can listen, you can do an ebook. There's lots of options for you.
Okay, so that's amazing. All right. So, yes, either your name or the organization. I will have a summary of my conversation with Dr. McConkey on the show page, which is myhelps.us. And I will link out to his book and his website and his foundation, as well as his Instagram and Twitter. So you'll have lots of places to reach out to him and follow his work. And yeah, it's amazing.
Yeah,
I
please,
hope
please
that
reach out on socials. Let me know how you like the book. And if you want to get involved, we'd love to have you.
yeah, I mean, it's great that, a lot of times we live in our own little world. And it's great to highlight a message that there's people that are hurting and we can help, we can get involved. And I like what you said that you don't wait for disaster to happen before you join something. You do it beforehand. Be involved in something. One of my favorite quotes is, you don't learn to swim when you're drowning, right? So
Yeah, very, very true.
yeah, we've got to, get involved and be the weight for someone's spear. And I like what you said, the tip of the spear or the people that's out there doing their jobs and working, but we also need to support them, and help them do their jobs the best of their ability. And
Thank you.
yes, I love it. Very great. Well, listen, Josh, it was excellent speaking with you, and you're doing good work. And I'm glad that God is using you with your message and your book and your organization to give back to the community. And I like also the fact that he funded it.
Yeah. Thank you for helping me spread the message.
Yes, yes, you're very welcome. So awesome. All right, guys. Well, listen, thank you for tuning in to this week's episode of Author's Corner. We have, said the name several times on the show, but the book is Be the Weight Behind the Spear. Go pick up a copy of it and definitely, follow Josh, and I will link out to it. If you missed it, just head to the show page, myhelps.us, and click the link. Thank you, Josh, for being in the show. Thank you, guys, for tuning in. And until next time, namaste.